Here we go. Chapter 2 is on clinical judgment, and Professor Gomez kind of alluded to this the first day of class, but just a little more information about clinical judgment and what we are looking for as your instructors when you're in the lab, clinical settings, and in the classroom. What we are really looking for will be on the last slide, and I'll fully explain it when we get there. So, Chapter 2, Clinical Judgment. I do not own this material. Under fair use, I'm providing lecture content for only my nursing students using this material. All content within is for only educational purposes and does not provide medical advice. All right, so under our thinking, doing, caring, what does nursing involve? Think about the different things that you think, the things that you do, and the caring that nursing involves. How do you show clinical judgment in those realms? So, thinking about that, where did this clinical judgment thing come from? Well, we used to call it critical thinking, we might call it clinical judgment. It's kind of, it's been out there for a while. As you can see, there are different people who have tried to define it. It's kind of like air, right? It's kind of hard to define. What is air? Well, some people would say it's oxygen. Some people will say it makes things float, right? So it's kind of elusive. So in 2019, they kind of thought about it, and the Board of Nursing is like, okay, we just can't send people through nursing school. We have to be able to evaluate their clinical judgment. How do you evaluate clinical judgment? What I think is clinical judgment might be very different from another instructor. So they're trying to nail down Jello, okay? So Tanner came up with the Tanner scale in 2006. And then later, Benner, Patricia Benner, Tanner, and Chelsea came up with a different one in 2009. The common factor amongst all of these is the utilization of a process that promotes safe patient care. So again, being able to recognize and interpret a client problem, prioritizing it, prioritizing your responses to it, taking action, evaluating outcomes, and modifying actions as needed. Okay, so it's not just somebody tells you, hey, go put in a Foley catheter, and you go do it. That's being a CNA. A CNA does tasks. Okay, a nurse thinks about, is that an appropriate order? Does my patient really need it? And if not, how am I going to advocate for them to choose a different outcome? Okay, so that's a little different about clinical judgment versus just going and doing something that somebody tells you to do. So there have been, if you think about it, there's all kinds of nursing knowledge that goes into nursing. Some of it's theoretical. People have theories about nursing and nursing knowledge. Some of it's practical, hands-on, self-do-it skills. Some of it is self-learned knowledge of the disease process. And then some of it's also ethical, that it's the right thing to do. Okay. So if you think about ethics, it's usually doing the right thing when no one's watching kind of thing. What's ethically right for everyone, not just one person. Okay. So clicker check. Which type of nursing knowledge requires an understanding of the pathophysiology of the disease process, the medical treatment, the client, and the family factors? Do you think that's practical knowledge, self-knowledge, ethical knowledge, or theoretical knowledge? So where in nursing school do you learn the nursing knowledge required to understand the pathophys? Where did you take pathophys? So if you think about it, practical knowledge would be like the lab. I already knew it would be B. C would be it's ethically unlike not, we should not do this. That's kind of like the legal aspect, the ethical aspect of it. And then there's theoretical knowledge. So if you think about it, sometimes people call lectures theory. Okay, so there's a theory and a practical side of nursing. Theory you learn from a book. Theory you are told by experts. Practical you learn yourself. Okay, hands-on skills, doing it. Okay, so theoretical knowledge is understanding the pathophys of disease processes, medical treatment, and client and family factors. Practical knowledge would be up in the sim lab or the clinical lab or the clinical setting where you are practically doing it, hands-on, in the moment, learning from that. Okay, so you need class, you need clinical, you need lab to put all those pieces together. Not one type is better than the others. Okay, so theoretical is the why. It consists of the information, the facts, the principles. This is the boring part of nursing, right? But you've got to understand it in order to do nursing. So there's a reason why you do have to do some modules, you have to do some learning on your own, because having someone tell you is not enough. A lot of people have to read it, see it, think about it, then observe it. Then it makes sense. Okay. So Tanner's model of clinical judgment came up with the 4 aspects of nursing. And she decided that a lot of the times what she saw in research in the academic environment, there was 4 aspects of clinical judgment. 1, you have to notice. 2, you have to interpret it. 3, you have to respond to it. And then 4, you reflect back on how you did. Okay? So all 4 of these are very, very important in nursing. We don't just go put in a Foley catheter and say, oh, I caused an infection. Well, that's too bad. You should be thinking about that every time you're putting in a Foley catheter. Okay? 1, you notice the patient hasn't peed in 8 hours. 2, what do I do about that? I interpret that as, oh, maybe they have a UTI, something's wrong, their belly, their bladder's still asleep from surgery. I am interpreting my noticing of a cue. Okay, so how many times do you notice something, but that's as far as you get? As a CNA, that's all you're expected to do, right? Is to write the vital signs down, and it's somebody else's problem. Maybe you go and tell the nurse, hey, that's really low. Okay, but a CNA's job is to do and to record and hopefully come and tell you about it. You have to notice that those vital signs are going up or those vital signs are going down. You have to interpret, is that expected, unexpected? If it's expected, blow it off, continue to monitor. If it's unexpected, oh my gosh, what do I do? Let me treat it, then I'll call the doctor to get some orders. Okay? But at every point in nursing, you have to make that decision. Is this garbage in? Throw it out. Or goodness in, I need to pay attention to this. Okay? When you're getting report between nurses, there will be a lot of garbly gunk that doesn't make any sense. That is not value added. Noticing and interpreting is a big different skill. Okay? Then when you interpret it correctly, that it is a problem, then you're responding to that crisis, calling the doctor for the catheter. You explain to him why you need it. They have not peed in 6 hours. They have not peed in 8 hours. This is what I've done. I've run the water. I've put a warm washcloth on her bladder. I've done a bladder scan. It's 800. I need a Foley catheter insertion or a straight cath. Okay, you need to call the doctor to get the order, then you can respond by putting it in. Okay, But a big missing piece in nursing is that we don't reflect on how is that working. Okay? So once you put the Foley in, you relieve the pressure off that bladder, but now what? So when you measure that urine, was there 800 or was it 100 and extremely concentrated? Okay? This is the reflect on and in action. This is what makes you different than a CNA. A nurse reflecting in action is in the moment when you measured 800 on the Doppler, but you're only getting 100 back. You should be thinking, what's wrong here? Maybe put the Foley catheter in the insertion of the tip a little bit longer. Maybe you're too short, okay? These are things you're thinking in your head when what you expect is not what's coming back out, okay? Reflect on action is, oh, if I didn't put it in the right place, I wouldn't get urine out, okay? While you're putting in a Foley catheter, there is a good chance on a female that you end up in the vagina instead of the pee-pee hole, okay? So, reflecting on action or in action, you would tell someone, go get me another kit. Leave the first catheter in there, you won't hit the wrong hole twice. Put in a new catheter, okay? When I don't get what I expect, well, how do you know? How can you reflect if you don't know what you expect, okay? So it's not just go in, do a task, and be done. That's the CNA level of thought. That's the LPN level of thought. We're bringing you to the RN level of thought. If I don't get what I expect, what do I do? Evaluation. Evaluating your practice. Big time critical piece in nursing. You've got to evaluate how is your patient responding to your measures that you did. Then we can go back to the doctor, find out what we need to do, if this patient needs to go home with a Foley, if I just leave it in there overnight and then try again in the morning, right? So you're part of the team that's reflecting after you've noticed, interpreted, and responded, and reflected on that, okay? So a lot bigger than just common sense, okay? It's a lot bigger than common sense. So the Lassiter clinical judgment rubric came up with 11 dimensions, and that already used those 4 aspects of Tanner's model, okay? It categorizes the progression of development in such dimensions like beginning, developing, accomplished, exemplary. Maybe you've heard of, what's her name? Benner's novice to expert, right? Patricia Benner came up with novice to expert. Novice being straight out of school, 6 months of practice or less, then you advance to an advanced beginner, then you advance to a proficient, then you advance to an expert. How does that come about? Well, you don't know what you don't know when you come out, right? All nursing is finding a pattern of behavior, of patient behavior, of pattern of things going on. If you've only done it once, you're always going to be a beginner. If you only do a skill once a year, you're going to have to refresh. If you have developed competency, you can do it without looking up the policy and do it correctly according to the policy. If you're accomplished, you can do it without looking up the thing, and you can also teach it correctly to someone else. Exemplary would be you can teach others at the clinical level. Okay, so preceptors need to be at least accomplished, exemplary, before they become preceptors, because you got to know the job before you can teach it. Okay, so that's what we're trying to do in nursing school, is getting you from that beginner level to that developing level before you take the tests, NCLEX, because NCLEX literally only tells your employer that you're minimally competent, that you will not kill somebody, okay? That's why you go into a residency program to become a developing, accomplished nurse over the next year, year and a half, two. It depends how many times you see that kind of patient. If you see 17,000 transplant patients a year, you're probably going to develop competency a lot quicker than somebody only sees two. Okay? So, really, nursing in the first 6 months is just figuring out what you don't know and filling those gaps. Then you become a better nurse over the next year because you're actually able to see those processes, see those patterns, see those things. So residencies aren't just an extension of nursing school. Residencies take you that next step. Okay? There's only so much that we can teach you in nursing school. There's only so much time in a day. We are literally getting you to not kill somebody. Okay? Not even kidding about this. When I tell people that, they lower the expectation that they must know everything before the end of the program. You will never know everything because healthcare is constantly changing. That's why you need to be a lifelong learner. What I did to babies 5 years ago, much less 10. If I knew then what I know now, I would be embarrassed, right? Nursing is constantly evolving. You've got to be a lifelong learner. You are never going to be the expert. If you're the expert, it's time to probably find another profession because you're dangerous, especially if that happens in the first 2 years of your practice, right? So think about this. You're in this for the long haul. You will continue to learn. We will continue to change the curriculum to meet the new needs of nursing as we go. Okay? So what you learned now will not be what we teach nursing students in the next 5 years. Okay? Nursing is an evolving process. So the state boards of nursing came up with a clinical judgment model of their own, which measures whether a test taker has met the established degree of clinical judgment and decision-making abilities to be a safe practitioner. This is literally what I just said. Minimally competent to not kill somebody. Okay? So the NCLEX test only says whether you have or have not gotten to the level of clinical judgment and decision-making abilities to not kill someone, to be a safe practitioner out there. Then they expect the hospital that you go to work for, or the nursing home, or the hospice situation, whatever you find yourself in, will continue to accelerate your knowledge in the next 6 months to a year. Then you will be a fully fledged practitioner. Okay? So that helps you to recognize, analyze, organize, prioritize, and use your knowledge to make safe clinical decisions on a test. That's it. That's what we as nursing schools are prompted to do for you as long as you're in the program. We are teaching you how to recognize cues, analyze them, make sense of them, and put them in order to prioritize who should be seen first, and use your knowledge to make self-care decisions on your own if you needed to, without anybody else. That's not real in nursing, right? Because there's always a preceptor, there's always a charge nurse if you ask for assistance, right? But we minimally need to require that you know minimally what to do. Definitely ask for help. That's also what we're teaching you. You can't know everything, okay? That's why people who love cardiac teach cardiac. You will not see me teaching cardiac. I don't do hearts, I do uteruses. And that's the way we like it. They like hearts, they don't like uteruses. Around the world, nobody in hearts like uteruses. And that's okay. All right? Every person finds their own niche. That's what you like to do. That's your passion. That's what you go into. So, general practitioner coming out of nursing school. You know a little bit about everything, and then it's your employer's job to get you to the next level. Okay? So, the importance in preparation to become a registered graduate nurse is that you must be able to recognize, analyze, organize, prioritize, and use your knowledge to make safe care decisions. That's why I can't tell you what's on the test, because if I tell you what's on the test, I won't be there when you're in practice to tell you what the answer is, right? So that is something you need to gain knowledge by studying, by looking up things, by explaining things, by knowing this stuff, because I cannot be there for the test. I've already passed 2 NCLEXs, okay? I don't need the test, all right? Now it's your turn to do this. It's our job to get you there, okay? So there are layers of clinical judgment. Layer 0 means clinical decisions. Layer 1 is comprises the outcome, so clinical judgment. Layer 2 questions form and refine the hypothesis or evaluate care that was given. Layer 3 contains clinical judgment tasks, which include recognizing clues, analyzing clues, taking action, evaluating outcomes, blah, blah, blah. Layer 4 questions give you context, individual and environmental factors, and you have to figure out what's going on in those cases. What would be the best decision, okay? So layer 0 is literally knowledge. Yes, no, don't do it, do it. This is right, this is wrong, basic. Everything else comes from that. So they start layering the test, okay? So you might start with some easier questions and then they move up, move up, move up. So when we talk about noticing, what does that mean? What is the process of noticing? So it develops an impression of the client's situation, a course of action taken by the nurse, a process of examining actions implemented, or the reasoning process nurses use to make sense of the initial clinical situation. Which one is the process of noticing? So, gather information, noticing next, right? So what do you think the B is? B is an implementation. That's what you do. Process of examining the actions implemented. That's evaluation. Okay. That's how you answer questions. You figure out, okay, what do I know? All right. So A, noticing entails performing an impression. So forming an impression based on the number somebody gives you. If I get a blood glucose of 80, am I worried? First thing in the morning, no. After a meal, yeah, right? Noticing tells you, what's your first impression when you get those numbers in your hand? What's the first impression when the patient starts coughing? Not even has to tell you he's been coughing for a week. You know those people in class, you're like, what's wrong with you? Are you sick? Because you keep hearing them behind you. That's noticing, okay? That's noticing. Putting together 2 and 2. What's wrong with her? She's sick. What's wrong with her? Okay? Just getting the paper and putting the numbers in the chart is not noticing. That's collecting data. So clinical reasoning, when you think about it, is the process of synthesizing that knowledge and information from numerous sources, incorporating experiences to develop a plan of care for a particular client or case scenario. That's what takes so long when you get out of nursing school, to really be good and be able to notice things, because you need that process of synthesizing the knowledge, thinking about what you were told in nursing school, thinking about what you were told in orientation. What should I do about it? Okay, so that in lies critical reasoning. You're gaining that in the next 6 months to a year on the job. Requires a reliance on your knowledge and experience to form conceptual image of a patient's problem and its effective management. So, those of you who say, well, I've already been a CNA for years, I've been an LPN for years, that's great. You have more knowledge to pull from, but now we're elevating it to the next level, okay? So it will still require you to do a little reading, thinking at a different level. That's why you came to nursing school, okay? That's why you came to the BSN level. You must be able to step into a management role and manage other people's thinking as well, eventually, okay? All right, so the importance of clinical reasoning, it's an essential component of developing clinical judgment and practicing safe care. That's why we need to have some thought process that you are clinically okay to be out there and practice self-care, safe care, okay, in the clinical environment. That's what we're looking for in the clinical environment as a maybe advanced beginner. Are you okay? Are you safe? That's our goal. That's what the nursing board does, right? When the nursing board gets a little note that everybody's signed off at Arizona College that you're okay, that's literally what we're saying. You won't kill someone, okay? We have to say that to the board so that the board will let you sit for the test, okay? So that's on our head as faculty. We're giving that onus to make sure that people are safe out there, okay? The thought process of that is, look to your left, look to your right. Would you want them taking care of your mom, your dad, your sister, your brother, your baby? That's the question, okay? We all know nurses that we know that you're like, oh, God help me if my mom ever goes in the hospital. I don't want them taking care of her, right? We've all had good and bad impressions of people in healthcare, right? You make sure yours is a positive. You have a job every day coming to school to show us that you are at that level, okay? You have a job every day when you go to clinical. Clinical is nothing but a job interview. People are taking notice what you do, what you don't do, and how outgoing you are. You could have a job offer before you finish nursing school. People notice, people watch. You want to be the one that they say, hey, what's her name? I want her working for me. You don't want them to say, why do they stand against the wall all day? Okay? So just consider school being a job interview. Consider clinical. Consider simulation. Consider any time that you're in your uniform, you are a representative of Arizona College. Pretty soon, that uniform is going to say Baycare, HCA, TGH, whatever. That's a direct representation of that school, that hospital, whoever you work for, okay? So make sure that people aren't talking about it, they're talking to it, okay? So practicing professional nursing requires strong critical reasoning skills because of our rapidly complex, changing healthcare environment. What my mom came into as an LPN is not the same healthcare environment there is today. What I came into is not the same healthcare environment as today. What you will be going into is not the same healthcare environment. that you might have started in. Okay? So we're constantly complex, changing healthcare environment. That's the nice thing about nursing. If you're ever stuck, sick of what you do, you can always back up, learn some more, and go in a different direction. Ineffective clinical reasoning skills is a major factor in the failure of nurses to respond appropriately to deteriorating client conditions. That says nurses, that doesn't say new grads. You remember that. There are nurses who have been nursing years and do not appropriately respond to deteriorating patient conditions. Okay? So all of us, it takes all of us, all of our clinical reasoning skills. So I don't care if you've been a nurse 30 years, 20 years, or 2, you need to be watching everybody's back. In a positive manner, if you see something, you have to say something. So if you're thinking about it and they're telling you something in report and you're like, wait, hold on, what did you say? And you're seeing it differently, you must speak up. You might be the difference between life and death for someone. Not appropriately responding to a deteriorating patient condition. These days, we have clinical tools that help us do this. The Muse score, the Pew score. Okay, Muse score comes off your vital signs. Every time somebody puts vital signs in, it might set off an alert in the ICU. The ICU nurse shows up and says, hey, what's wrong with your patient? And you're like, what do you mean? That's not seeing the signs and symptoms of sepsis getting started. Okay? Not being able to see a patient going downhill is the inability to respond appropriately to deteriorating patient conditions. Okay? We have simulations, we have drills, we have case studies to help you with that. All right? If you want more, let us know. We can certainly make it happen for you. But that is our goal, is to look at where are your clinical reasoning skills and how do we improve them before you get to the NCLEX, because the NCLEX is a series of patients that you're going to see and respond to make sure that you're minimally competent. Okay? So critical thinking is a combination of reasoned thinking, openness to alternatives, ability to reflect, and a desire to seek truth. Okay? The biggest one for me is the openness to alternatives and the ability to reflect. You don't know what you don't know as a new grad, right? I might have different colored lenses on, I'm seeing it through a different light. You might be seeing something else. Every single one of us must see something, say something. Everybody has a different perspective coming in. Okay? You have to speak up if you see something. You never want to be so closed to alternatives that you're pushing it out of your mind. Okay? Always be open to feedback, an alternative, a different view. That's what nursing is about. Not necessarily that you have to agree with it, but that you take it into perspective. Okay? Yeah, I've thought about that, but what about this? That's not conflict. That's opening a discussion. Okay? Sometimes feedback seems like a conflict. It's not a conflict. It's just, have you considered? Okay? Sometimes it's easier to come across as, have you considered, than, what the heck are you thinking? Okay? So you may hear us say, have you considered? You might want to consider, right? That's somebody trying to give you feedback. The most correct definition of critical thinking is a problem-solving process that enables one to show others they are wrong. an examination of one's own beliefs in order to defend them intelligently. Purposeful analytical thinking that results in a reasoned decision, or rational thinking that results in obtaining one correct answer. What's your thoughts on that? Showing others are wrong are probably not the reason why you want to do critical thinking, right? It's not about right and wrong. Defend them intelligently. Sorry about that. The dogs were barking. For those of you who know my dogs, they like to bark. All right, so probably not A and B. So you're between C and D. Both of them sound good, right? But is there ever one correct answer? Sometimes there might be two correct answers. Okay, so the purposeful analytical thinking, deliberate thinking, critical thinking enables a person to see that there may be more than one right answer. Okay, so that's why D was incorrect, because you're not getting it narrowed down to only one answer. You're just being purposeful and deliberate about what your answer is in the situation. All right, critical thinking skills. What are we going to do? How are we going to help you with that? Objectively gathering information on a problem or an issue. When you read a case study, gather all information. Ask yourself if you need more information. Clarifying question. Evaluate the credibility and usefulness of the information that you've gathered. Sometimes it's gibberish, sometimes it's fluff, sometimes it's noise. Not everything you get is going to be useful. And then recognize gaps in your knowledge. Maybe go look it up just in case. You're getting a report on a patient and you're like, oh, I have never taken care of a patient like that. And you'd go look it up and find out about it before you go take care of them. Listening carefully, reading thoughtfully. So when you go to the internet to find out about it, do you go to the American Cancer Society or you go to cancervictim.com? So listening carefully and reading thoughtfully. You probably want a journal article, a non-biased opinion about that kind of cancer. Okay, so separating relevant from irrelevant data and important from important data. Okay, that's what we'll be doing over the next couple semesters with you, is what's trash, what's fluff, and what's real. Okay, a lot of the times you're so busy analyzing everything, you can't figure out what's real and what's not. Okay, what's important, what's not. Organizing and grouping that information in meaningful ways, making tentative conclusions, inferences, about the meaning of that, visualizing appropriate solutions to a problem, like when my patient couldn't pee. Maybe I need a Foley, right? I'm visualizing a potential solution to this problem. I don't call the doctor and say, what do you want to do? I offer him a solution. Do you want me to straight cat them or something? What would you like me to do? Right? Exploring advantages, disadvantages, and consequences of each one of those potential actions that you have in your head. I could cause an infection, but I would get rid of his bladder spasms, right? So you're thinking the goods and the bads of everything and weighing it out. Then evaluating the credibility and usefulness of those sources of information. Yes, I know there's a risk for infection, but I'm going to maintain aseptic technique, right? So you're evaluating the risk versus the benefit of all of your solutions. All right, recognizing differences and similarities among things and situations. Oh, I had this last week. The guy that week, he was coughing a lot and they came back with pneumonia. Do you think this is pneumonia? Wait, what did I do for him? Oh, I gave him an incentive spirometer. Okay, I told him to drink more water, right? So that's where I'm saying the patterns of patients will develop over time. You cannot teach that. You have to experience that. Okay? So prioritizing or ranking data as needed. So which one's more priority? Is it more of a priority to go give pain medicine, discharge a patient, ambulate a patient, or the one falling out of bed with the side rails down? Okay. Safety, 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 right? The pain medicine will never win. The discharge instructions will never win. Those are not priorities. Okay. Intellectual autonomy. Being able to think yourself is super important in nursing school. You have to be able to think yourself and think yourself through this because you've got to take that test by yourself. So it doesn't matter if you go look on studentpapers.com and buy the paper. It's not going to help you in the long run. You're also potentially going to get kicked out of school for plagiarism. Intellectual curiosity. It's okay. Intellectual humility. It's okay to be curious and think out loud. We anticipate it. We want it. If you think out loud for us, we can assume that you are going down the right track or the wrong track and get you redirected faster. You don't answer, then we get frustrated, right? Be curious. Be how do you say? Humble. Be very humble. I don't know how many times a day people teach me things. You have to be humble, okay? Empathy, courage. Have that courage to say the wrong thing. It's okay. All right? We'll never chastise you for being wrong. It's better to have wheels turning, right? So have that courage, have that perseverance as well. If I had $1 every time that stupid mannequin did not give birth when I wanted it to, I could buy a brand new mannequin, okay? But I persevered through that. I'm resilient. It's like, oh, darn you. Next time I'll just shove the baby through because we're having a delivery today, right? So just because you gotta know that's not it yet, just because you say, hey, I want you to come back and practice a little more and then I'll check you off next week, is not a bad thing. Failure is not final. Failure is you need a little more work. Let me help you put it together better. Okay? So failure, perseverance is huge in nursing. If you stop because you did something wrong, that's the wrong mindset in our nursing career. We make different decisions every day. Some of them go well, some of them don't go so well. You've got to persevere through that. Fair-mindedness. Be fair. No one is an RN in this school. No student is an RN already. Be fair. Don't say, I know because I am already, you're not an RN yet. Okay? So be fair. Everybody's on the same learning platform. Some people might already be halfway around the track. Everybody's going to end at the same place, taking the NCLEX. Okay? So whether somebody is on lap 2 or lap 3, we're all still going to finish this marathon. Okay? So be fair, be fair-minded. Don't think somebody knows everything already. They don't. Even if they tell you they do, they don't. Okay? On the other hand, also, don't sell it as, I've been doing this for years. You may have been doing it incorrectly. Okay? So let's just go back to square one. What do I know? What do I not know? Where are my gaps? Where do I need to fill them? Some people will have bigger gaps than others. Some people will have smaller gaps. We're still going around the same track. Okay? We all need to be on lap 3 before the end of the semester. Okay? Have confidence in your reasoning. Go big or go home, right? You're either going to win or you're going to fail. But in failing, you learn 3,000 other ways to do it correctly. Okay? So have confidence in your reasoning, but talk to us about your reasoning. Then we can see where it went wrong or where it went right. And that's what we love to hear is you're on the right track. You're so close. You're right there. But what? And we push you to that next level so that everybody's at the same level by the end of the quarter. Okay? So that's our goal. We are not mean. We're trying to force you to a place where you're at your highest functioning. Okay? Sometimes that's nice. Some people don't think we're nice about it, but at the end of the day, we all have the same thing in mind, getting you to be the best nurse you can. Okay? So critical thinking is really, really important. Why? When you're faced with a complex situation, you don't want to run. Each client is unique. Every single person will come with a different presentation. Are the symptoms the same? Everybody's different. Everyone coming into nursing school has a different level of knowledge, skills, attitude. If you've had 3 kids, you are still a nurse because you took care of those kids. Okay? You know more about pediatric nursing and maternity nursing than you think you do. Nurses apply knowledge to provide holistic care. Nursing is an applied discipline. We don't just learn things and not apply them. I apply them every day. Everything I've learned for a reason. And it gets me to the next level that I need to go to. Okay? So everything you learn is not going to be useless. I swear to God. Even though in the moment you might think so. Nurses use knowledge from other fields. Nursing is fast-paced. The scientific basis for client care changes constantly. So please do not, like I said, do not think what I'm teaching you today I'll be teaching in 5 years. Critical thinking is linked to evidence-based practice. So the more you look up evidence-based, the more critical thinker you are, the more you're challenging the status quo. The best thing that I can tell you is the way we've always done it is still incredibly stupid. If we do things the way we did 25 years ago, that's not nursing. Okay? Critical thinkers think outside the box and ask why. It's okay to ask why. The answer might be go look it up, I'm not sure. Therein lies, we both need to go look it up, right? Because you're asking a really good question. All right, so a nurse newly employed at a hospital questions a standard of client care that does not seem to follow evidence-based practice. Which critical thinking attitude is the one demonstrated by the nurse? This is interesting, right? Because it could be a couple of them. It probably took her courage. Okay, so someone new asking why the standard of care that hospital doesn't seem to follow evidence-based. What is she? She's saying what's in my head doesn't match up with what's in the policy. What do I do? So that's giving her the ability to be autonomous and not just groupthink, right? Hate the word groupthink. Critical thinkers are not afraid to question things. They do not proceed with questionable action simply because that's the way we've always done it. Okay? It's good to have intellectual autonomy, be able to think for yourself and ask questions. It's the manner in which you ask that that's offensive, right? That's not the way we do it. May be seen as offensive, okay? Double check yourself. So the critical thinking model has 5 steps. There's a contextual awareness, inquiry, considering alternatives, analyzing your assumptions. We all know what assume means. So we analyze what we think is true versus assume that it's true. When you analyze somebody and you're like, huh, I wonder if, yeah, ask them. Because if you're wondering it, reflecting skeptically and deciding what to do. Okay. All right. How is the nursing process related to critical thinking? They're interrelated, but not exactly identical. Some nursing activities do not require you to reflective critical thinking, but they also must be done skillfully. And problem solving is the nursing process. Okay? So if you're asking yourself that, that's why. So nursing process correlates and overlaps with clinical judgment. The process facilitates clinical decision making and guides clinical reasoning on a more solid foundation to help you develop that clinical judgment. What is caring? Caring, like Professor Gomez said, we cannot teach you. It's something you have, something you develop. Caring is always specific and relational for each nurse and each person you encounter. Caring is not abstract. Caring involves thinking and acting in ways that preserve human dignity and humanity. So the components of caring: knowing, being with, doing for, enabling, and maintaining belief. We'll be talking about that. And then that full spectrum nursing that we're trying to provide you is that unique blend of thinking, doing, caring with a purpose of affecting outcomes in the client's situation. And some of those concepts are thinking, doing, caring in the client's situation. Always think about the client at the end. The client should be first, but sometimes we think about them all the steps, hopefully. So at the end of the day, nursing is about client outcomes. No matter what, who says, everything we do has to do with a client outcome. All right, so you've got thinking stuff like the theory class, you've got doing stuff like doing the skills, thinking about the process, putting it all together. You've got the caring thing, that's a self thing, an ethical thinking thing. And then you've got the client situation to keep in context. The data, the preferences, the context, the religion, etc. Okay? So everything will be changing. You will constantly be evolving. What works for one patient or what works for one nurse will not work for another. College courses such as microbiology, human growth development, present context that is considered part of the theoretical, they present content which is considered part of theoretical nursing knowledge. That's what we talked about. Your courses provide you the theoretical knowledge. The critical thinking, it's a pleasant Saturday afternoon and you're meeting an old friend who you've not seen in 2 years. She says, I've heard you decided to be a nurse. What made you choose that? How would you reply to their question? Why? Why nursing? The term critical thinking seems to suggest that good thinking is an intellectual activity rather than involving feeling and emotion. How do you think a nurse uses critical thinking to practice in a caring manner? Just some thoughts. As a client, which safe, effective care competence would you choose for your nurse to have if they could only be an expert in one thing? Would you want the thinker, the doer, or the caring person? This is a huge conversation, right? Is it more important to have the person who got 100 on every test? Is it more important for the person to have the person that got 100 in the skills lab? Or is it more important to have someone who has self-knowledge ethical knowledge, effective in interpersonal skills. Question. The best nurse is to have all, right? But if you had to choose one, depends, right? To me, if it's my Foley catheter, I want you to be good at the skill. But what if I don't need the Foley catheter and the doctor's ordering it on me? Then I would want the thinker to think, no, that's not right, right? But I would want the caring person putting it in so they would get it done and over with. Interesting question. All right, so I just wanted to show you the Creighton Competency Evaluation Instrument. If you ever see this, this is the one that Arizona College uses. And I just want to be very consistent and blunt with you that it also chooses to use assessment, communication, clinical judgment, and patient safety on it. So if you look this tool up, it's readily available. I can also give you a copy, but it's basically, this is what we're looking at when we're giving you feedback at the end of the day. Do you obtain the pertinent data? Did you perform a follow-up assessment if needed? Did you assess the environment in an orderly manner? Did you communicate? Did you provide clinical judgment? Did you just write numbers down or did you actually interpret them? Did you look for labs? Did you look for subjective data? Did you ask the patient some things? Do you use evidence-based rationales for your interventions, for your outcomes? Do you model that? Do you verbalize that? Do you reflect on your clinical experience? Do you delegate appropriately? That's all clinical judgment. And then, of course, patient safety. Did you put the bed down? Did you put on gloves? Did you use the right precautions when you went in and out of the room? Did you do the procedure correctly? And did you reflect on potential hazards, errors, issues that might come up? Because if you reflect on them, you may avoid them in the future, right? So, does that make sense? Let me know if you need more information on that. But that's what an instructor is looking at. This is one of the tools that we use to say yes or no, get critically thinking before the end of the day. Now, some of you may have some zeros and ones in here, right? Some of you may have more zeros than ones in the beginning. You're a beginner, okay? At the end of the day, as long as we're all lapping the track at one, honestly, so you can even take this and honestly assess yourself as well. Most students rank themselves a lot lower than they think they are because you're an honest novice, you know that. Therein lies your feedback to yourself. Am I doing okay? Should I have done more? Could I have done more? Or is this as good as it gets? Always being open to that feedback, always being open to that reflection. Reflection is a maturity thing. To be able to reflect on your practice and take feedback from others is huge. All right, that's it. Talk to you later.